All right, yes, let's talk a little orthopedics right now. And I was just asking Dr. Boyette, not like a chiropractor, but you said bone and joints. And then I said, are you a fan of a chiropractor? And you said what?
Yes, I do. We use chiropractic referrals when it's appropriate, and we use physical therapy. I feel that anytime you can avoid surgery, and chiropractors, physical therapists, athletic trainers, all these modalities are part of helping these patients avoid surgery, and sometimes getting them better without surgical intervention. But when the patients do require surgery, that's where we come into the picture.
Okay, well, I know we've been interviewing many doctors from Athens Limestone Hospital, and how long have you been working with the hospital? I've
been with the hospital since August,
okay.
And I moved here from Marion County, which is home for me, where I grew up in Alabama. And we are starting a new orthopedic program for the hospital, and we have a new partner actually starting in January.
Great.
So that'll make us 2 strong in orthopedics.
And that person's name?
His name is Bill Lawrence,
okay.
And Bill comes to us from Jackson, Mississippi.
Wonderful. Now, do you have to be referred to come to your office, or do you take walk-ins? How does that work?
We don't do walk-ins. We do allow call-ins. Most of our patients are referred from the primary care physicians.
Okay.
But we have patients that once they've seen us, and if they call back with an orthopedic problem, then we see those. But we don't do general medicine, and we don't do general walk-in colds and cough type stuff. We limit our practice to orthopedic surgery.
What are some of the symptoms or some of the cases that you do take?
A lot of what we do in our aging baby boomer population is
you're going to be busy.
Joint replacement surgery. So we take care of a lot of arthritic joints, and
knee replacement, hip replacement,
right?
All that stuff.
Shoulder replacement. We do a lot of sports medicine type stuff for both athletes and for the weekend warriors, and we do a lot of arthroscopy, and of course we take care of all the fracture care that comes through the emergency department there at Athens Hospital. So
great. And what are your hours?
We're in the office Monday through Friday. Of course, right now I am solo, so I have to spend part of my time at the hospital doing surgery, and so we generally try to be in the office a half day a week, and then we try to do surgery a half day a week. Sometimes that's varied a little bit depending on what types of slips and falls the snow may bring.
Do you hope for snow?
Well, in my experience, snow is good for business. So,
well, at least he admits that. That's right. What kind of advice can you give people to try to avoid an injury? Well, one, stay out of the snow, but other than that,
I think good common sense with lifting mechanics is important.
Now, people don't have good common sense a lot, so come on, Doc.
Sometimes we get caught up in trying to accomplish a task and not thinking about how to perform that task, but there is usually a safe way and a more risky way of doing it. I see a lot of injuries this time of year on ladders, and one caution I would give people with hanging Christmas lights and Christmas decorations is caution on those ladders, because lots of injuries, lots of bad injuries happen from ladders.
They really do.
And injuries that are life-changing for people, and it can be avoided by taking a little extra time and taking some safety precautions, and using a lift instead of a ladder, or possibly getting someone who is a professional to do that for you.
Now, why is that true, a rule that if you're a man out there and you're 40 years old, don't get higher than 3 feet off the ground?
I think that's a great rule.
That happens a lot. We know a lot of buddies that have thought, I'm just going to fix this shingle, and next thing you know, they're in the hospital.
Exactly. It's, we all have a tendency to take on a little more sometimes than we're prepared for, and when we do that sometimes in a hurry, and I think that's when people get in trouble, is when they're in a hurry, they're trying to accomplish a task, and they're not taking the time to prepare and to avoid injury. And also, I think just general conditioning. As we enter our 40s, sometimes in our mind we can still do what we thought we could do when we were 20, and our bodies, without some preconditioning, just aren't prepared for that. And that's where people wind up with tendon injuries and ligament injuries, rotator cuff injuries, etc.
Okay, well, thank you. And again, where is your office located?
We're across from Publix in Limestone Medical Village, and we're currently in our temporary space, but as of January, provided our construction people stay on time.
Oh, they will.
We're looking to be in a new area of the building there, and we're really looking forward to getting into that, because we've quickly expanded into our current space, and we need some more space.
Well, great. Dr. Boyette, thank you very much. Thanks for being with us this morning. It's snowing out there, so be careful, or just kind of misty and rainy, so be careful on your way into work. Going to take a quick break. When we get back, Teresa Smith joins us. Stay with us.